Information presented on this program, Rogers Community Television and all Healthline participants cannot assume responsibility for any false or misleading information. Information presented on Healthline does not substitute for or replace recommendations given by appropriate healthcare professionals, and under all circumstances, personal examination and treatment by medical experts for any health-related conditions must be completed. Information presented on Healthline must be verified with your primary care physician or medical specialist.
Hello everyone and welcome to Healthline. I'm your host, Dr. ColinElkin, and tonight we have a great show for you. Everybody who's followed the show for the last year or so, as I've been hosting, knows that I'm a chiropractor, and I'm quite vocal about my opinions about things. And we've had a lot of very interesting shows on Healthline. And, as a chiropractor, I try to live what we call a chiropractic lifestyle, and that includes, good nutrition, a healthy, balanced diet. I exercise regularly. I have a very positive mental attitude and great spiritual health. And one of the most important things that often gets overlooked is a properly functioning nervous system. And that's what we're going to be talking about tonight as we talk about spinal health. And of course, my guest tonight is one of my colleagues, a good friend of mine, Dr. Mark Mitchell from Cambridge. I'm going to introduce Mark right now. Mark, thanks for being on the show.
Thanks for having me, Colin.
Well, pleasure to have you here. So, Dr. Mitchell's going to be talking to us tonight about chiropractic and spinal health. And we're going to get started right away. In fact, I'm going to ask Dr. Mitchell, Mark, can you tell the viewers, first of all, why did you become a chiropractor?
Well, it happened a long time ago, Colin. I actually had a personal experience with chiropractic. My uncle is a chiropractor in Kitchener-Waterloo, Bruce Orrs, and my father was suffering with a breathing condition, which was medically diagnosed as asthma. He'd been diagnosed with this condition since he was a child, and a number of times had almost died because of it, because of asthmatic attacks. Now, fast forward till my dad was about 26, 27 years old, and he'd had a series of very serious asthma attacks. And we were told by the family physician that they'd tried everything they could. He'd been medicated in various medical techniques, and he wasn't getting much success. And the physician suggested that we move to Arizona or Calgary to get in the clear air. And my dad was just starting out in his career, and I think probably was a little fearful about moving away from Ontario, born and raised here and having family here. And his brother-in-law, new brother-in-law, was a chiropractor and said, Tom, why don't you come in and see me? Perhaps I can help you. And of course, my dad came from somewhat of a medical background, and his aunt was a nurse in Rochester, New York. Rochester, New York, if people don't know, have a very well-respected medical school there. And he asked my aunt for advice. My aunt was not pro-chiropractic, and my dad decided the heck with it. He was going to try it. He felt he had nothing to lose, and he got adjusted. And as a result of that adjustment, my father was never hospitalized again with an asthma attack. Now, because of that, we all were taken to the chiropractor. Myself, my brother, my mom went, and we all went at least once a month. And I'd been going since probably I was about 4 or 5 years old. I'm now 37 years old. I can say I've been adjusted at least once a month my entire life. And at this time of my life, I get checked once a week to make sure my spine's in alignment. If it's subluxated or out of proper alignment, there's nerve pressure, I get adjusted. And my family as well has been under care. And when I was about 18, I had a hockey injury in which I was smashed on the boards head first. I damaged my neck. I thought I was paralyzed. I couldn't move for about 15 minutes. I went along for about 2 weeks, not able to move my arms. I was under medical attention. I wasn't satisfied with what was happening with me. I turned to my uncle again. He adjusted me, and it was immediate. I got restoration of the movement in my arms. And at that point in time, as an 18-year-old, I decided this is what I wanted to do. And that's how I became a chiropractor.
So you've had a personal experience,
Yes.
And many chiropractors can't say that, myself included. I was brought up in a very medical family, of course, and the more I got to learn about chiropractic care, the more I liked, and the more I explored it, and finally did, decide to become a chiropractor. Can you, and before I ask you the next question, I'm going to just remind our viewers that welcome to the show. We are live this evening, and you'll see the numbers flash across your screen. This is a phone-in show, so please join us this evening. Dr. Mark Mitchell would be more than happy to answer your questions about chiropractic. Have your comments. We're going to discuss some issues about chiropractic that have been in the media a lot lately, one of which, and we're going to include this with our poll this evening, Do you feel chiropractic care is safe? And we're going to address those issues tonight on the show. So that's our poll this evening. Please join us. You'll see it flash up on your screen now. Do you think chiropractic care is a safe method of spinal health care or spinal health treatment per se? And we're going to talk about the wording of that. We're going to talk about the issues of chiropractic safety. And so please join us this evening. Give us your opinions and ask us your questions. Mark, discuss your education. As a chiropractor, chiropractors are licensed as one of the 5 healthcare professions that are licensed or allowed to call themselves doctor. Discuss your education for the viewers.
My education was that after high school, I went to the University of Guelph. I went for my 4 years at Guelph, got my Bachelor of Science degree. I graduated from Guelph in 1985. At that point then, I went to the Canadian Memorial Chiropractic College in Toronto, and I graduated from there in 1989, so it's a 4-year course. So I took 8 years of post-secondary education. Then I did my Canadian and Ontario board exams, and at that point I was licensed to practice chiropractic in the province of Ontario, and I began practice in November of 1989. So I think people should realize, as far as chiropractic education goes, chiropractors have 8 years of post-secondary education, at least recently, and our education is quite intense. In fact, I mentioned to you before we came on the air, Dr. John Duckworth, who in fact some medical people will know him, he's since passed away. Dr. Duckworth was our professor of anatomy at CMCC, and he was Professor Emeritus of Anatomy at University of Toronto Medical School. And this is in 1986, Dr. Duckworth mentioned that our anatomy course was more intensive than that was found, as far as hours spent in the lab and in the classroom, more intensive than that was at the University of Toronto.
And that's an important point, and most people don't know that the education of a chiropractor is very comparable to that of a medical doctor, with differences, of course, being chiropractors don't study the pharmacology part of it, but focus their attention on the spinal anatomy, neurophysiology, and of course, spinal techniques of adjusting.
Although we did have, remember, I don't know whether you had when you went to school, but Dr. Franklin, again, was a professor of pharmacology at University of Toronto. We had a full-year course with Dr. Franklin, so in fact we did have a pharmacology course. And I took pharmacology at University of Guelph as well. So we do have a background in this, plus my biochemistry is at the University of Guelph as well.
Yeah, interesting. Okay, great. Now, Dr. Mitchell uses an interesting chiropractic technique, and this is going to lead us into talking about the whole philosophy of the profession. First of all, the profession of chiropractic is based on something called the subluxation, which you have talked about earlier. Now, you use an upper cervical technique. Can you tell us what that is specifically and why you use it?
First of all, I think we have to define what a subluxation is. A subluxation has to have a number of components. Number one, the subluxation has to have the vertebra or spinal bone out of proper position in relation to the vertebra above and below. Secondly, the foramen, or the holes between the spine, or between the vertebra, and also the spinal canal has to be decreased in size. Thirdly, there has to be pressure, bone on nerve pressure, on those nerves. And lastly, and fourthly, there has to be a decrease in mental impulse, or what we'd call innate intelligence, a mental impulse along that nerve to the body part. Now, by definition, therefore, a dead person cannot have a subluxation, because a vertebra can be out of alignment, there can be pressure on the nerves, but a dead person is dead. There's no mental impulse. And that's important to understand what a subluxation is. Now, my technique is what's called specific upper cervical technique. There's many people who use upper cervical technique. Mine's a certain procedure that way. This developed through B.J. Palmer, who is the developer of chiropractic. In about 1914, a physician by the name of Dr. Schwanberg was critical of chiropractic and stated that you could not get bone on nerve pressure in the spine. And B.J. Palmer, being very objective and very scientific in nature, decided he was going to investigate this because he thought maybe Dr. Schwanberg is in fact correct. And he found that Dr. Schwanberg was correct in one respect. Schwanberg was studying the lower cervical spine and upper thoracic spine, so lower neck and upper back. And Schwanberg found that no, he couldn't get pressure there, and B.J. agreed with him. B.J. then went to Germany. This was early 30s, and unfortunately it was during the concentration camps, Dachau, and they had access to people who had just died. And so they got fresh cadavers, and they studied these cadavers and found, you know, Schwanberg was right in one respect. You couldn't get pressure lower down, but you could in fact get pressure in the upper cervical vertebra, between the atlas and the axis. Now, why is this area important? A couple reasons. One, every nerve that goes to the body has to go through this area. We know that because, I mean, when you guillotine somebody or hang somebody, the principle is you're disconnecting the brain from the body. That's why it works so effectively. Secondly, these two vertebrae are different shape than any other vertebra in the spine, and there's no disc between them. There's freedom of movement. And what can happen is, based on the stresses our bodies are under, chemical, emotional, physical stresses, and also thermal stresses, if the body cannot adapt to those stresses, this vertebra can lock out of position, placing pressure on the nerves. The problems a person can have in lack of function in the body can be directly attributable to which nerves are pressed based on the position of that bone. So as an analogy, think about your house. You're sitting there tonight watching the TV, then all of a sudden your wife yells out, or your husband or your son yells out, "Mom, Dad, the kitchen lights are out, the stove isn't working." Now, what do we do usually? Usually we go down to the fuse box, look at the breaker switch and see where the breaker's gone over, flick it back on. That's what I'm doing when I'm checking the spine, and I'm checking the upper cervical area. Is that vertebra out of position? Is it subluxated? If it is, then it needs to be adjusted. We adjust it to remove the nerve pressure. Now, I adjust everybody in the upper cervical area. I also sometimes give adjustments in different areas as well. But everybody gets an upper cervical adjustment. And that's whether they have low back pain, leg pain, whatever their complaint.
That was my next comment. And this is interesting because it's important to clarify that chiropractors don't necessarily treat any condition or any disease. Chiropractic is not a treatment for anything.
Correct.
Chiropractic really is a way to enhance the body's own innate intelligence, enhance the body's own ability to heal itself. And now, so somebody comes into you with a certain condition, and most people do present to chiropractors with a certain condition or a certain symptom. Discuss how you would analyze that person, okay? And go ahead with their care.
The person would come into the office and they fill out a history form. The history form basically goes over their past health history. We go all the way back to birth. In fact, we even go back to what their mother did while they were carrying them. The reason we're interested in birth is, according to Dr. Gutmann in Germany, a medical doctor, he said 95% of children are what he called have joint dysfunction in the upper cervical spine as a result of the birthing process. So we start at birth and then we go through the whole health history, injuries, drugs, whether legal or illegal taken, because that is important, what kind of foods they've been eating, things like that. Then the patient will come back with me. We do get them to watch a video, so they get a partial education of what's going to be going on during their initial visit with me. I bring them into the office, I give them a brief explanation about chiropractic, and then what I do is ask them to tell me why they came to the office. And after we go through the history, we go into the other room, we do a physical exam on them. My physical exam consists of postural analysis, range of motion, muscle testing. Then I use a device, which I didn't bring this evening, called a neurocolimeter. What it is a thermal device. You use, I think you use the Insight 7000.
That's correct,
You have a thermal device as well on yours. It picks up heat differences, which is based on nerve pressure. If the person has a positive thermometer or neurocolimeter reading, we then take films of the spine. I always take films of the cervical area to find out their listing, how I'm going to adjust them, and also the area complaint. For instance, if George came in with breathing difficulties or stomach problems, that was his major complaint, I'd probably take either a full spine view or a view of that area of the spine that I thought was related to the stomach, low back, I do that as well. Then after that, I develop the x-rays while they're at the office, so I can at least give the patient an idea whether I can help them or not on their initial visit, try to give them a slight idea what's going on. Then I've got to measure my x-rays, and my technique, measurement's very important. So I know the degree to which the vertebra is subluxated, so I know the amount of torque and the angle to put my arm to make the adjustment. My adjustments as well for people who go to chiropractors, I do it in a knee chest position, so it's a little different. Some people that come to me from other chiropractors find that a little different, but as long as it works,
sure,
that's what they're interested in.
You have a lot of success with that.
Yes, and the thermometer reading also is taken before and after every adjustment to ensure the patient needs to be adjusted, is subluxated on each visit, and if they are, that they've adjusted
then
and the adjustment has been successful.
Sure.
Yes.
Okay. We have Marilyn with us on line 1. Hello, Marilyn, are you there?
Yes, I am.
Do you have a question for Dr. Mitchell this evening?
Yes, I do. I wanted to discuss with Dr. Mitchell, or I would like him to discuss briefly if he could. I've listened to him talking tonight about holistic medicine, and as a mother of a 2-year-old child who's made the conscious decision not to immunize, I wonder if Mr. Mitchell, or Dr. Mitchell rather, could give some validity to that particular decision and discuss that with the viewers this evening.
Okay.
That's a great point, Marilyn, and that's actually something that we were going to come up to later on in the show. Go ahead, first of all, discuss your views on that for Marilyn and the rest of the viewers, and perhaps why.
I think it's important for Marilyn to understand as well, and the rest of the viewers, I'm a father of a 7-year-old and 3-year-old. Neither of my children have been vaccinated. I like the word vaccination better than immunization because if you look in the dictionary, they do have different meanings. I chose not to vaccinate my children. It actually started when I was at school. One of our questions on a board exam was, would you vaccinate, why or why not? And out through my research, I discovered about the polio vaccine that you're supposed to have a booster every 10 years. Well, I had had a I couldn't remember last time I had a polio vaccine. And also, the smallpox vaccine had been terminated, I think the 80s. I may be wrong as far as my dates on that. And one of my colleagues or classmates was a PhD in pathology, and I remember him saying, why would they stop vaccinating? You can never wipe out a virus. And I thought, maybe there's some validity to that. So I investigated further. I think a good book that I recommend to many of my patients on the vaccine topic is Vera Scheibner's book. I can't remember the exact title of it. I don't know, do you remember the title of that book?
No, I don't remember the title.
It's very well researched. Dr. Scheibner is a PhD. And my opinion as far as vaccination is you have to become fully...
A serious threat on the medical community?
Pardon me?
Isn't it something about a serious threat to the medical...
Something, an assault on the... something like that, yes.
Assault to the immune system. Yeah.
And basically, I think the important thing for everybody to remember, I made a conscious decision not to vaccinate my children, knowing all the risks and benefits of not doing that. Do not make a decision without becoming fully informed. I made the decision that was right for me. Sounds like Marilyn did for her. Some people, I give them information, they choose to vaccinate. That's fine. You hear a lot of things in the media about damage due because of vaccines. I mean, my problem is that the person hasn't been informed about that. If they know about it and they know the risks and they've consciously gone into that and done it knowing what the risks are, then you have to live with the decision you make. I live with the decision I make every day with my children. My children are healthy, happy, 7 and 3 years old. Another important point to make on this too, Marilyn, is you've probably heard this, as I know many people have that haven't vaccinated their children. People will tell you, well, you can't send them to school.
I'm currently facing that objections, not only from family members, but from other mothers in the community who are afraid that I won't be able to send my child to school.
Well, and that's false. You can get an exemption. You can get a religious, conscientious, or medical exemption of vaccination. The Ontario School Pupils Act has it. You can go to the library and you can get the form. I've got them at my office. What has to happen then is you have that form signed, notarized. It has to be sent to the medical officer of health so that if there is an outbreak of or they declare an epidemic, then the medical officer of health or the Department of Public Health contacts your family. You have to remove your child from school until the epidemic has been declared over. So as long as you realize that as well.
Well, frankly, if there's an epidemic in the school that my child is attending, I'll be pulling her anyway.
Right on. And then there was a measles epidemic in Kitchener a number of years ago, and a chiropractic colleague of mine that didn't vaccinate his children, his kids were the only ones sitting in the classroom. And then finally they told him to pull his out because all the other parents didn't send their kids because of the epidemic. And I
I'm just concerned. I guess we made the conscious decision not to vaccinate because you hear so many of the risks and side effects involved. And in fact, just in People magazine 3 weeks ago, there was a young fellow who was a perfectly happy and normal toddler at the age of 2 and then developed some serious neurological problems after a vaccination. The other concern I had with the program, maybe Dr. Mitchell can comment on that, is the variety of changes that are involved with vaccinations. I don't want my child to become a guinea pig.
Well,
something they've not perfected.
And you're right, Marilyn. As far as objection to vaccination, there's many different levels on which people are objecting to vaccines. As a chiropractor, I believe healing comes from within. I think vaccination is an outside-in approach to health. I mean, I don't take medications or drugs. It's just against my philosophy to do that. Some people object to it because of what's contained in it, such as mercury and aluminum. Now, we always, as chiropractors and other health professionals that don't agree with vaccination, including some physicians, we always had an objection to the mercury component in vaccines. And before, we were told, oh, it wasn't a problem, but they're starting to remove that. And then we all know about the latest thing about hepatitis B as far as what's happening in France and the request from the American Association of Physicians and Surgeons who want them to put a moratorium on hepatitis B until it's further investigated.
And even recently in the United States, when they vaccinated all these veterans, men in service for this anthrax, and now they've discovered that there was a serious problem with the vaccine. They've given out thousands of soldiers. Yes,
and I guess there's been a presidential order, though, that they have to do it.
Yeah.
But President Clinton didn't take it.
No, of course not.
But the vaccine issue is very complex, very controversial. I'll tell you, it's controversial within our profession right now as well. But my bottom line to my patients and anybody asks me is you become fully informed. The internet is setting us free. I think the internet's to our generation what the printing press was to the Bible back in the time of Luther. And it is freeing people up. They make very good health decisions now. And I'll tell you, people come into our office very well informed as far as their health. And I for one, welcome that.
Yes. Well, so do I. Well, thanks very much.
Marilyn,
nice talking to you, Marilyn.
Thank you for your call. You bring up a very valid point. And frankly, Marilyn, you're not alone. More and more people, and I see this all the time in my office, more and more people are choosing to go that route. And as Dr. Mitchell said, and for all of our viewers at home, for all of our viewers, basically, that is your right under philosophical, conscious, or medical belief. If you do choose not to vaccinate your children, you do have the right to do that. And yes, they can attend public school. You do have to fill out a few forms and jump through a few hoops, basically, to do that. But that is your right as a parent. So interesting topic. And I'm sure we could have probably a whole show on this topic. So we're going to carry on a little bit with chiropractic, but that is a very valid point and a chiropractic issue.
I think so too.
And as you bring up, because we do believe, and our philosophy states, that the body is a self-healing mechanism, health does come from within, any outside interference, thus being vaccination, really is hypocritical. It's an insult to our immune systems, and frankly, there is a lot of controversy about it right now. So we'll carry on. Let's talk a little bit about, as Marilyn talked about her children, let's get into that. Let's talk about children. Why should children be under chiropractic care, and at what age is it safe to start looking at children?
Well, Colin, probably like me, my children were adjusted or checked and adjusted when they were born. My 7-year-old, I was very keen. I adjusted her. We barely had the umbilical cord cut. We had, by the way, we had both our children at home. My children, while my daughter Alyssa was to a physician once, my son Connor, who's 3, has never been to a physician. I'm not saying that. Well, I guess I will say that with pride. I mean, it's my decision to do that. Both my children were checked at birth. One reason I do that is because of, like I said, the Gutmann study from Germany, who stated that 95% of children are subluxated at birth. Also, there's a number of studies that are coming out lately, and this is medical studies and chiropractic studies, about the possible link between that and breathing difficulties, which could result in SIDS. At least this is what some of the medical literature has been talking about. And for instance, in Britain, they told the parents to put the children on their back from on their tummies, and apparently the rates of SIDS dropped by 50%. Well, what's the difference? I guess it's the position of the spine. So my children were checked immediately upon birth. I see lots of kids in my practice. Maybe that's a reflection of where I am, that I am a father and I'm used to dealing with children. I think children should be checked regularly. I think they should be checked at birth. After all, your spine is developing from the moment of conception, and you're going to have this spine for your entire life. You're only going to get one. You're not going to get any replacement, and you better look after it. And spinal hygiene is very important to overall health of an individual. 70 years ago, and some of the older, well, maybe not some of the older people, some of the younger viewers will know this as well. 70 years ago, and even when I was at school, think how many people you knew that had rotten teeth because they just didn't know any better as far as looking after their teeth. And think what a wonderful job the dental profession's done about educating us about oral hygiene and looking after our teeth. I see chiropractic playing that role as far as spinal hygiene goes, and educating the public as the importance of spinal hygiene and overall health. I stated I've been under care probably since I was 4 or 5 years old. I'm 37 years old. When I compare myself to my friends, people I grew up with, my health is superior. I'm not sick. I can do what I want to do. Like I said to you, I'm playing hockey tonight. Got a couple buddies that would come playing tonight, and they wouldn't be back out playing for about 3 weeks because they couldn't move for a while. What's the difference? There's only one thing I'm doing different. And I'm getting checked and I'm getting adjusted. And I have since I've been young. As the twig is bent, so grows the tree.
And you bring up a very important point as you compare spinal hygiene to dental hygiene. Parents take their children to dentists. You take your children to get checked for cavities, not wait until they're having a toothache or having an abscessed tooth to take them for for a dental checkup. And this is the same principle with chiropractic. Go on and talk about that a little bit.
Well, let's talk about somebody that comes to your office that's 30 years old. You look at their spine, curvatures, subluxated curvatures, maybe some degenerative changes. This thing took years to develop. It didn't develop overnight. And it probably happened. Like some people are saying, well, these problems happen in the first 10 years of life. A lot of our health problems. For instance, what do they say about cancer? 20 years on average it takes to develop, something like that as an average. And it's taken years for these things to develop. And if we had caught them earlier, would that person have to come so frequently? How many times do you hear a person say to you, I got to come that much and that long? Well, this problem's had 30 years, 50 years, 20 years to develop. So the earlier you get it, the easier it is to correct. And why wouldn't you want to correct something before the symptom hits? I mean, why do we get checked? Why do I get checked weekly? I cannot afford physically or economically to be injured and be sick. I wake up every morning, I get up and go to work. It's so nice not to have to worry about headaches or taking medication or be worried about my health. Yeah. And I wish everybody could have that. And they can't. But they've got to use chiropractic correctly, and I think it starts when you're young.
Exactly, yeah. We have a caller with us. We have Pat with us on line 1. Hello, Pat.
Good evening, doctors.
How are you doing this evening?
Very good.
Good.
And you?
We've got a couple of minutes to our break, Pat, so go right ahead with your question for Dr. Mitchell.
Well, it's more of an announcement than a question. I've been listening with great interest. I want to commend you, gentlemen, for having a show on such a vital topic that affects of course, about 80% of the population will have back pain at some time in their lives.
Thank you, yes.
I wanted to announce on behalf of a group called the Ortho-Neurological Society that the Back Pain Center is opening in Brantford on Monday, December 6, 1999, at 22 William Street. That's at the Church Street intersection. And a phone number, if anyone is interested in making an appointment, they can walk in at 22 William, is 756-0603.
Well, that's great.
Now, the center is set up to eliminate, believe it or not, the symptoms of severe lower back pain and sciatica caused by problemed lower lumbar discs. That's bulged discs or herniated discs. And typically, these symptoms are eliminated in 7 days. Can you believe it?
Beautiful.
That's wonderful. Now, I guess my question back to you, Pat, is who's running the center, and is there a chiropractor there?
We're co-located with the Doctors Shackleton, and I want to mention that we began informing the public back in December 1998 in Kitchener, and it was because of a suggestion by a chiropractor of Kitchener that we made appointments with a number of the chiropractic societies around Ontario. And we made presentations to these societies. And of course, chiropractors well know that if you apply force in a direction for a certain amount of time, you can achieve positive results. And what we do is we show people how they can use their own body weight, gravity, and leverage to achieve the desired results of eliminating not only the pain and sciatica, but other symptoms such as constipation, hemorrhoids, and urinary tract problems, along with some of those that you mentioned.
And you bring up an interesting point, and Dr. Mitchell was talking about this earlier. With any type of interference, whether it be from a disc or a subluxation in the spine on that nervous system, that can cause all kinds of problems in the body as it affects the nervous system. You know, and of course nerves in the lower back, nerves throughout the spinal cord go to different parts of the body, different organs of the body, and that's how a physical trauma or a physical problem, a misalignment of the spine, can affect someone in that regard. It might not be with a symptom, it might not be with any type of pain, but it can cause some disease process that happens through the body.
Yes,
We've got, I'm going to have to interrupt you there, Pat. We're coming up to our break. I do appreciate your call, and thank you very much. Hopefully people will hear more about that service that you have in the next few weeks as you get open. Thanks very much for your call. We're going to be coming back in the next couple of minutes, so please stay with us. See you then.